Welcome back to the channel. Today we're diving into an important health topic, high cholesterol. You know me, I'm all about preventative care, and understanding the signs your body is giving you is a huge part of that. We're going to talk about 10 signs of high cholesterol because knowing the signs can help you take action early. Let's get started. We all experience stress and maybe even a little heartburn now and then, but when it comes to your heart health, it's crucial to pay attention to any unusual symptoms, especially chest pain. You know that feeling of tightness, pressure, or even a burning sensation in your chest? That's angina, and it's a major red flag when it comes to high cholesterol. See, high cholesterol can lead to plaque buildup in your arteries, restricting blood flow to your heart. And when that happens, your heart's not getting the oxygen it needs, especially during physical activity. Now, chest pain can be a sign of other conditions too, so it's super important to take it seriously and talk to your doctor right away. Don't brush it off as just stress or indigestion, especially if it's a new symptom or gets worse over time. Early detection is key when it comes to heart health, so listen to your body and get checked out if you're experiencing chest pain. Okay, so you're noticing numbness or coldness in your hands and feet, and it's happening more often than not. You might think it's just bad circulation, and while that can be a factor, it's important to consider high cholesterol as a potential culprit. Here's the deal. High cholesterol can damage your blood vessels, including those that supply blood to your extremities. When the blood flow is restricted, you might experience numbness, tingling, or even a colder sensation in your hands and feet. Now, I know it's easy to dismiss these symptoms, especially if they come and go, but trust me, it's better to be safe than sorry. If you're experiencing persistent numbness or coldness in your extremities, it's crucial to talk to your doctor. They can assess your overall health, check your cholesterol levels, and determine the underlying cause. Remember, early detection is key to preventing further complications. Now let's talk about something called xanthomas. These are small, yellowish bumps that can appear on your skin, especially around your eyes. They're actually deposits of cholesterol that have accumulated under your skin. While they're usually harmless and painless, they can be a visible sign of high cholesterol. So if you notice these little yellow bumps popping up, it's a good idea to get your cholesterol levels checked. It's always better to be proactive when it comes to your health. Xanthomas themselves might not be a cause for immediate concern, but they can be an indicator of an underlying issue. Remember, high cholesterol often doesn't have obvious symptoms, so these visible signs can be valuable clues. If you're concerned about xanthomas or any other skin changes, don't hesitate to reach out to your doctor or a dermatologist for a proper diagnosis. We all know that high blood pressure is a serious condition, but did you know that it's also closely linked to high cholesterol? You see, when there's too much cholesterol in your blood, it can build up inside your arteries, making them narrower and stiffer. This forces your heart to work harder to pump blood throughout your body, leading to increased pressure on your artery walls. Over time, this constant strain can damage your arteries and increase your risk of heart disease, stroke, and other serious health problems. Now, here's the thing about high blood pressure. It's often called the silent killer because it doesn't always have noticeable symptoms. That's why it's crucial to get your blood pressure checked regularly, especially if you have other risk factors for high cholesterol. Remember, prevention is key, and managing both your cholesterol and blood pressure is essential for maintaining a healthy heart. We all get a little winded sometimes, especially after a workout or climbing a flight of stairs. But if you're finding it hard to catch your breath even with minimal exertion, it could be a sign of something more serious, like high cholesterol. You see, when cholesterol builds up in your arteries, it restricts blood flow to your heart and lungs. This means your heart has to work harder to pump blood, and your lungs don't get as much oxygen as they need. As a result, you might experience shortness of breath, especially during physical activity. Now, shortness of breath can be caused by a variety of factors, including respiratory infections, allergies, and even anxiety. However, if you're experiencing persistent or worsening shortness of breath, it's crucial to consult with your doctor to rule out any underlying heart or lung conditions. Remember, early detection is key to getting the right treatment and preventing further complications. We all get headaches from time to time, whether it's from stress, dehydration, or just needing a good night's sleep. But if you're experiencing frequent or severe headaches, It's important to pay attention because they could be a sign of something more serious, like high cholesterol. You see, high cholesterol can affect blood flow to your brain, and when your brain doesn't get enough oxygen-rich blood, it can trigger headaches. Now, headaches are a common symptom, and they can be caused by a wide range of factors. But if you're experiencing headaches that are new, different, or more intense than usual, it's essential to talk to your doctor. They can help you determine the underlying cause and recommend the appropriate treatment. Don't just try to power through frequent or severe headaches, especially if they're accompanied by other symptoms like dizziness, vision changes, or numbness or weakness in your face or limbs. We live in a fast-paced world, and it's easy to feel tired or run down at times. But if you're experiencing persistent fatigue that interferes with your daily life, it's important to listen to your body and seek medical advice. One potential culprit behind unexplained fatigue is high cholesterol. You see, when your arteries are clogged with cholesterol, it reduces blood flow throughout your body, including to your muscles and organs. This means your body has to work harder to get the oxygen and nutrients it needs, leading to feelings of exhaustion and low energy. Now, fatigue is a common symptom of many conditions, so it's important to consult with your doctor to rule out any underlying medical issues. They can assess your overall health, check your cholesterol levels, and determine the best course of treatment for you. Have you ever noticed a soft, rubbery lump under your skin? These are called lipomas, and they're benign, non-cancerous growths of fat cells. While they're usually harmless and painless, they can sometimes be a sign of an underlying condition, including high cholesterol. Now, the exact link between lipomas and high cholesterol is still being studied, but some research suggests that people with high cholesterol may be more likely to develop these fatty tumors. It's important to note that not everyone with high cholesterol will develop lipomas, and not everyone with lipomas has high cholesterol. However, if you notice any new or unusual lumps or bumps on your body, it's always best to get them checked out by your doctor to rule out any potential problems. Stroke is a serious medical emergency that occurs when blood flow to a part of your brain is interrupted, depriving brain cells of oxygen and nutrients. High cholesterol is a major risk factor for stroke because it contributes to the buildup of plaque in your arteries, which can block blood flow to your brain. Now, there are two main types of stroke: ischemic stroke, which is caused by a blood clot blocking an artery, and hemorrhagic stroke, which is caused by a weakened blood vessel rupturing and bleeding into the brain. High cholesterol increases your risk of both types of stroke. It's important to recognize the warning signs of a stroke, which can include sudden numbness or weakness in your face, arm, or leg, especially on one side of your body. Other warning signs include confusion, trouble speaking or understanding speech, sudden vision problems, dizziness, loss of balance, and severe headache. When it comes to managing your cholesterol levels, knowledge is power. That's why regular blood tests are crucial for understanding your numbers and taking control of your heart health. A simple blood test called a lipid panel can measure your total cholesterol, LDL cholesterol, the bad kind, HDL cholesterol, the good kind, and triglycerides, a type of fat found in your blood. Knowing your numbers empowers you to make informed decisions about your lifestyle and work with your doctor to develop a personalized plan to manage your cholesterol levels. Remember, high cholesterol often doesn't have obvious symptoms in its early stages, so regular blood tests are essential for early detection and prevention. Talk to your doctor about how often you should get your cholesterol checked based on your age, overall health, and risk factors. Thanks for watching. We've covered a lot of ground today, from chest pain and numbness to those little yellow bumps called xanthomas. Remember, high cholesterol is a serious condition, but it's often manageable with early detection and lifestyle changes. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips. Your health is your most valuable asset, so take charge of it. Stay healthy, and see you next time.